All right, so we will have a conversation today about larva cestodes, and this is part of the series of cestodes discussions that we've had before. And let me share my screen. There we go. So the parasites, you've discussed a bit about the nematodes, trematodes. Now we're the cestodes, and the general features of the cestodes, as you probably might be aware, they have tap-like segments, so like tape-like tapeworms, and they're usually the sexes are not separate between male and female, and they don't have alimentary canal. And that means they don't have the body cavity. The examples like tenias and echinococcus. But today we discuss other larva cestodes and including Hymenolipinus and Dipylidium. Right, so these normally, the presence of adult cestodes cause mild to very moderate pathology in man. But if man gets infected by the larva stages of the cestodes, then they could get severe or serious pathology in the infection. And this usually happens when man becomes the intermediate host of the cestode. So this can happen in both pseudopylidian and psychophilidian larva stages. And these are the ones that occur in man. So important part is the larva stages of these particular parasites are the ones that are going to be most serious. And this is an outline of many other cestodes that you might have. But to begin with, we will talk about two important ones. One is Tinea multiceps. This is just an example of how they would look like in terms of the larva stage, the eggs, the larva stages, the adults, and the proglottids. And also we'll talk about Spirometra, which is another type of tapeworm that is of concern. So this means we're going to discuss sparaginosis and coneurosis. Starting with sparaginosis, this is an infection that is caused by a plerocercoid of Spirometra. Now, this is also known as Diphyllobothrium. And usually dogs and other carnivores are the definitive hosts, so canines. And procercoids, the procercoid stage usually happens in cyclops, which are the crustaceans in water. And the more advanced stage is the plerocercoids, which happens in reptiles and amphibians and small mammals. So the first stage is in the first intermediate host in cyclops as procercoid. So if you ingest the cyclops, you get the procercoid stage, and then you get an infection that way. Or if you ingest or get in contact with the reptiles that have infected with the plerocercoids, that's when you get this infection. Now, for man, if man accidentally swallows a cyclops, which is the first stage, they can get the procercoid larvae, and the plerocercoid larvae will develop in man, causing a disease known as sparagana. I'm going to show you how this one looks like in a moment. So human sparaginosis is due to Spirometra mansoni or Spirometra mansinoides, and in Africa there is Spirometra theileri. This is a life cycle of the disease of sparagana, and it's important to note that sparagana can live in humans for up to 20 years in the human host without getting out. And let's say this is the human being at the center of the disease, and a dog or a cat that is infected with the adults in the small intestines, they can give embryonated eggs that comes out in feces of the dogs, And when they get in water, they get embryonate to form embryonated form. And then the coracidia, they hatch from the eggs and then they're eaten by the crustaceans. Now, these are the crustaceans such as cyclops that I've mentioned. Now, the crustaceans, inside the body of the crustaceans, these coracidia develop into procercoid larvae. And these procercoid larvae are inside the body of the crustaceans. Now, at this stage, these crustaceans are very small. So they could be eaten up by fish, or they could be eaten up by human being through ingestion of contaminated water. So if you take contaminated water, you might remember when we were discussing other diseases that are waterborne. If you take contaminated water, there's a stage of procercoid larva will develop into the plerocercoid stage, and then this is when it gets problems back. Or alternatively, if the fish gets infected, they can be the ones that, when they're eaten, they can get to cause this disease in human beings. Okay. So the plerocercoid, which is a stage after the pericercoid, is a motile worm, which has variable size, can be as tall as 50 centimeters. And the adults, which are typical of the pseudophilidian cestodes, are usually found in small intestines of the canines. Now, remember this, when you're talking about this stage, the adults are usually found in the small intestines of the canines. And its prognosis is generally uncommon. However, it occurs in places like in the tropics. As you know, the diseases of the poor people who don't have processed water can also occur in South and Northern America. Human infections occur in three ways. As I said, you ingest the procercoid infected cyclops, or known as crustaceans, and then the ingested, or alternatively, you could use the plerocercoid in undercooked frogs or snakes. The people who eat frogs and snakes as their food. And also there are medical practices where they take the skin of frogs or snakes and they apply it on wounds or in eyes as treatment for some problems in health in Southeast Asia. This is a traditional medicine practice that seems to have helped them over the years. So this practice is risking exposure to the plerocercoid of this stage, which is in the snake. So remember this. If you eat or get exposed to frog or snake meat, you get the plerocercoid stage. Or if you take the cyclops, you get the procercoid stage. And now then, what happens with the larva? Now the larva is to migrate into subcutaneous swellings under the skin, or the worms can be discharged in these swellings. You can have eosinophilia. The lesions can be in the chest, the legs, in periorbital tissues, which end up damaging the eyes. It can even go all the way to the brain and cause neurological consequences in your brain. So this is an example of a picture of a larva that is found here. You can see it is the brain matter, and this is being extracted from the brain. This is usually a person who's already passed away. This is a periorbital swelling, you can see here. And then this is where the larvae is being extracted from an eye of a human being. And you can see it's tape-like, right? So this is how it can even lead to eye damage and blindness. So how to diagnose this? You could have some serological testing, or you could do excision, as we've seen in the previous image. These are excisions to identify the spargana, and the surgical removal is the best result when you want to remove. But then when it's involving the brain, it is usually very difficult to remove it surgically. So what you need to do in control is health education, better cooking of frogs if you're going to eat frogs and snake meat. Avoid applying these snake tissues to eyes or wounds, and boiling your drinking water to kill the cyclops, which might contain procercoids. Even filtering of the water will be able to get rid of these crustaceans, just like we've seen in the previous discussion of nematodes when we were talking about the Medina worm. Right, so if you have any questions, you could put them in the chat and then we could discuss them next time. Then the next topic we will talk about is the coneurosis. The coneurosis, this is caused by Taenia multiceps. Remember the difference between the spirometra and this is Taenia multiceps. But then the dogs are the definitive host and the sheep are the intermediate host. Right now, this is where we don't involve the water boars, cyclops. This is mainly dogs and sheep. Sheep is the intermediate host of the coneurosis. And the larva stage is called conurus, which is a single cyst with multiple invaginated protoscoleces. You're going to see an image shortly. And then they may go even up to several centimeters in diameter. This is going to look like a cyst. And if it happens in sheep, for example, when they get infected in the brain, they cause a disease known as Stargardt's disease. The sheep will not be able to walk very well, be walking sideways and staggering and almost falling down. It's a very unpleasant experience. So coneurosis in human is rare but extremely serious disease, and because these parasites have tropism to the brain and the eye. Tropism meaning they like to go and feed and attracted to go to the brains and the eyes. So although extracranial sites can also occur, but mostly it's the brain and the eye, just like what you've seen in this spargana. Now, this is how it might look like. So this is a life cycle. And then you can see the difference between the coneurosis and the sparganosis involves terrestrial animals, so dogs and sheep and rabbits. And then this is when the dog gets the adult form of this parasites in the small intestines, and then it will end up developing the proglottids. Proglottids will develop the eggs will come out, and then they will embryonate, and then they'll be ingested. So let's say the sheep eat the grass or something like that is infected with this eggs. Now the oncospheres that are develop into the intestines of these herbivores, they start to penetrate and then circulate in tissue. They can go all the way to the brain of these animals or the eyes, and then they would cause those diseases, spargana. Now, when a human being gets infected by eating this contaminated vegetables or things like that, the same thing happens to human beings, and the oncospheres will hatch into the intestinal walls, and then they'll be circulating into the tissue, and then they get into the subcutaneous tissues or the eyes. So again, they could be found in the tropical diseases of Africa, South America, Europe, North America. Common in their sheep, and you could have clinical manifestation as neurological signs due to intracranial mass with inflammation. And you remember, this is a foreign body that is happening there, and might end up causing sonophilia and inflammation into the brain tissue. If left untreated, can lead to neurological diseases with very terrible outcomes, depending on the site where this one is involved. And if it is involving the eyes, it can lead to loss of vision. This is a picture of that. This is a brain in goat. So you can see this is a brain, and this is the coneurosis. This is a protoscolex that's very big, and this is in the muscle tissue. That is the protoscoleces that are the cyst that is embedded. You can see the next image. The cyst, this one, when you rupture it, you can see there's protoscoleces here that are valid, that are held within that cyst. And in case it invades the eye, contrary to the spargana, you would see, you could be able to appreciate this darts, which indicate this thin skin of this cyst, and then this will be the whole thing. And there are protoscoleces that are in there, so they cause pressure symptoms and may even lead to loss of vision. So usually, if you do a CT scan, could show a very clear cyst and the protoscoleces that are very known. And then if you do a histological sample, you'll be able to see the protoscoleces that have a rigid cuticle, typical of conjurosis. And the treatment, you do surgical excision, you could remove the cyst, or you could give praziquantel for human and sheep. Praziquantel will tend to resolve the disease. These are the examples from the magnetic resonance imaging MRI. You could see this is a cyst here, or a patient, and this is another formation of a cyst, and this is after removal of the cyst. So the control for conjurosis is health education. You treat with the praziquantel for the definitive host, also in the intermediate host. Meat inspection is very important so that you don't feed your dog or the carcasses of infected sheep. And then you could try and make sure that the stray dogs are eliminated, and just be clean, right? Eat clean your vegetables well before you eat them. Great, so that's the cestodes of major importance. And now we're going to talk a little bit about cestodes, the other cestodes, the minor importance. So we'll start with the dwarf tapeworm infection, which is also known as Hemiplex nana. If you remember, this one has a direct life cycle, does not have intermediate host. Now remember the other one, the first one we discussed today was the one that has human, amphibians, and crustaceans. This is Spargana, and the dogs and sheep or rabbits. This is for the conjurosis, but for Hemiplex, this does not have any intermediate host. The transmission is dependent on an immediate contact, and the eggs are very delicate, and they don't survive long outside without a host. This is why it's also of minor importance. The cases are not as high. Infection is transmitted from hand to mouth and rest frequently through food and water. Unhygienic habits in children are the most important cause of the transmission. So autoinfection may occur, especially in immunocompromised individuals. Now, autoinfection, this is when you get the infection inside the parasite, and then it matures, and then it reinfects you again while it is inside your body. This is when you're talking about autoinfection. And why in immunocompromised individuals? This is because the human immunity tends to suppress the development of these parasites when in the body. So the infection is much more common in families and institutional groups. Natural definitive hosts are human, mice, and rats. Man is the chief source of the infection. Occasionally it can happen, the rodents can be that. They're known as dwarf worms because they could be like pretty short compared to other ones. It could be, up to 20 millimeters long, and is about 200 proglutids. And this is small, globular with cup-shaped suckers. You're going to see an image shortly. And it has short rostellum with single row of hooks, which are 20 to 30 hooks, capable of retracting themselves into the apex of the scolex, just like how you see here. So this is Hemiplex nana scolex, and you could see this is the stage where it has retracted the scolex inside, and then this is where it has protracted itself outside. And these are the proglutids that could be there. It's about 4 to 5 times as broad than long, so you could see this. They are proglutids are short in length, but they're wide. All right. And they have a single genital pore. They have around 3 testicles and 2 bilobed, and a bilobed uterus. The sac-like uterus can have up to 180 eggs per sac. These are the sacs of the uterus we're talking about. And the eggs of Hemiplex nana are quite nice looking. They're oval shaped. They could be 30 to 45 micrometers long. Have 2 membranes that encode the oncosphere with hexacanth or hooklets. These ones. These are the hooklets we're talking about, right? 2, 3, 4, right? Can have they have hexacanth hooklets. And then it has these polar filaments that tend to end up developing into, these are thickenings. These are the polar thickenings that will tend to develop into polar filaments. Eggs are very transparent. So the life cycle for the Hemiplex nana, the adults in the upper part of the ileum after ingestion. The gravid progotid will rupture into the intestines and then free the eggs, which immediately becomes infected when they pass out the feces. And then if you ingest it by the new host, the oncosphere is liberated into the small intestines and then penetrates the villus, loses the hooklets, and then in 4 days it becomes the cercocystis. Right. So this is a life cycle. Then the cercocystis breaks out of the villus into the lumen and then attaches itself with the mucosa. And then it starts to produce progotids up to within 12 days. Eggs appears again in feces in 30 days of the infection. Heavy infections and internal infections can occur in that. So after the eggs are produced, they could be immediately infectious, and then they can hatch, and then free the oncosphere, and then bam, it goes on and on again, right? So lifespan of the adult is just a couple of weeks. This is the life cycle we're talking about. That the eggs come out, they can get ingested again, either by an insect or by human beings, and then they continue the life cycle, or it could continue the life cycle inside the auto as an auto infection. So infections usually appears in large numbers, usually with no damage to the intestinal mucosa, but this is when you're talking about light infections that has no symptoms. But fairly heavy infections that have almost 2,000 worms or more in children, they start showing the typical constitutional symptoms of lack of appetite, irritability, abdominal pain, sometimes with or without diarrhea, start to get anorexia, vomiting, dizziness, and sometimes epileptic seizure can occur depending to occasion. And maybe most of the symptoms will be due to the allergic reactions that are caused by the parasites. And the diagnosis, when you find the characteristic eggs and feces, I hope you remember the eggs we talked about. These are the eggs. And then the treatment, you could have niclosamide or praziquantel will be quite useful in terms of treating these patients. But, prevention, because it's like direct transmission, a single host involved, is very successful in terms of transmission. So, but just make sure you remain in a safe, good environment, cleaning, sanitary disposal of human extra. Just make sure you don't stay with feces. And then rodent control can be also an important part. Right, that is Nana, Hymenolipis nana. Now we're into Hymenolipis diminuta, which also has a worldwide distribution, also known as cosmopolitan distribution. And the infection is also an infection of rats and mice. But then the intermediate host, the larva rat or the mouse and fleas, and adult mealworms like xenophilas, these ones can also happen in humans. And in humans, children under 3 years old are usually most affected, and we will see why in a moment. So adult worms usually are larger than Hymenolipis nana. If you remember, we said H. nana is the dwarf. These ones could be up to 20 to 60 centimeters by 5 to 7 millimeters. The other one was only 0.7 millimeters wide. And this one has up to 1,000 proglottids, while the other one had about 200 proglottids. Scolex is club-shaped, and it does not have the hooks. It is unarmed, while the other one we saw, the rostellum, is armed and could be retracted. So mature proglottids can be, up to 2 millimeters wide, and they're not very much distinguishable from the H. nana ones. These are the eggs. So the eggs are circular ovoid, but different from the Hymenolipis nana, they don't have the polar filaments. I don't know if you remember, I showed you those polar thickening. They looked like this in the eggs of the Hymenolipis nana. These ones. These ones are present in Hymenolipis nana, but in diminuta, they are not present. Okay, so these ones are not present in Immunolipus diminuta. And then you could see here, yeah, this is a comparison for you to see. This is Immunolipus diminuta. These are H. nana eggs, and the proglotids are almost indistinguishable. So the life cycle, in the intermediate host, the hatched embryo develops into cercocystis, which then is ingested by the definitive host. It matures within about 20 days. And the man is infected accidentally by foods or hands contaminated with the insects. The human infections are usually light. The lifespan is short, up to 5 to 7 weeks, especially in experimental infections. You would see now this is, in this case, someone can ingest the egg, the insects that have the fleas and things like that have had the circus, and then they would develop in the intestines, and then pass out the eggs, continue the cycle. They're ingested by arthropods, which are the immediate hosts, the oncospheres. Then they develop into the hatch in the intestinal walls of the arthropods, and then the life cycle continues. Diagnosis: you find the eggs in the feces, and treatment is the same as for the Hymenolipus nana. Prevention: same problems, rodent control, environmental hygiene, make sure you safeguard your food, and treatment of infected individuals. Now, next one is going to be Diploidium caninum, which is diploidiasis, but now, as you can see from the name, it's caninum, it's a dog tapeworm infection. And it is the definitive host are dogs, cats, and wild carnivores. Man is an occasional incidental host, and infections in human are reported in children mostly under 8 years of age. Transmission: you swallow the fleas and lice that comes from dogs. So this is when children, or even people who have pets, play with dogs, and could hug the dogs and things like that, and the fleas can feel fleas that are infected. Shower can come out of the water, can come out and then get into the mouths of the children and eat them, and then bad things happen, then they could get contaminated. So a high percentage of dogs are usually affected. Intermediate hosts, the larval fleas of dogs and cats and humans can get to be intermediate hosts. If you want to look at the morphology, these are quite long in terms of 10 to 70 centimeters long, with about 200 proglotids. Scolex is small, globular, with prominent oval suckers. And just like when you saw in the Immunolipus nana, these also have retractile rostellum and has hooks. You can see them here. They look slightly different in terms of the shape, but they both have the armed rostellum, and this is when the one that is retracted into the sac. It is armed, but it is retracted inside the sac. Okay, and these are the suckers. They suck things. You can see the suckers here also. And it's vase shaped. As you can see, the proglotids are vase shaped. So they look like a vase, like a vase to put flowers into. So these are vase shaped proglotids, and they have a double set of reproductive organs with genital pore that is midway in each side. You can see these are the reproductive genital pores here, here, or even you can see them here. And then the proglotids could be up to 7 by 3 millimeters. And they're packed with membranous egg capsules. They could have not so many, about 15 to 20 eggs. Gravid proglotids separate in groups or singly, and they're capable of moving. They can creep out of the anus, or they can be passed out in feces. So this is a very unique feature for this. So gravid proglotids have life of their own. They could be able to move. This is an image I've just shown you. And the eggs, now the Diploidium caninum eggs come out in packets, right? These are the packets of eggs that are laid together. And they have globular, and the nice looking they have a hexagon larva. The life cycle, adults are found in small intestines. Eggs are expelled out by contraction of proboscis or disintegration outside intestines. Rarely it happens inside. Some become embedded in host fur, like in the perianal region. And this, as you remember, when we're talking about this, is for dogs. So they could be embedded outside the fur in the perianal region, especially for dogs that are very furry. So when ingested by the intermediate host, the oncospheres escape from its covering and penetrate the gut wall and developing the cystosocroid larva inside the adult flea. Right. So this is an important thing. Why did you even mention that they are embedded in the host fur? Is because these are the dogs. The dogs can have fleas, and fleas are usually within the fur coat of the animal. So if there's proboscids or the eggs around the flea areas, and then these fleas can eat them, and then they will develop into the cystosocroid larva inside the flea. So when the infected flea is ingested by man or a definitive host, the cystosocroid are liberated the lumen of the gut. In 20 days, it becomes an adult. Infections are usually single and sometimes could be no symptoms. Finding the characteristic proboscis in eggs or masses with feces, and this would be the diagnosis. And praziquantel or niclosamide would be your drug of choice. Prevention, should not be allowed to fondle with dogs and cats with fleas, and also just treat your dogs and cats if you have them as hosts. Make them covered with flea protection and vaccines, and wash them often. Pets should be given anti-helminthic treatment and anti-insecticide treatment. Great. So that's all I had to share with you today. If you have any questions, please put them in the chat, or we can compile them and we can discuss them next time. All right. See you around.